The World Health Organization says this morning there are now 600 suspected cases of Ebola in Central Africa and 139 suspected deaths. Those numbers are expected to rise.
I'm deeply concerned about the scale and the speed of the epidemic.
The outbreak prompted the World Health Organization to declare it a public health emergency of international concern. That's just one step below a pandemic. It was caused by a rare species of the Ebola virus, which has not been seen for over a decade, and there are no vaccines for this particular strain, so officials are working to adapt existing vaccines to fight the outbreak. But testing and manufacturing will take at least several months. Dr. Paul Ngwakum is the Senior Health Advisor for UNICEF Africa and joins us now. Dr. Ngwakum, good morning to you.
Good morning and thanks for inviting me.
Doctor, I know you are not in the region right now, but you have seen Ebola in the past in Africa. It is a horrifying disease. Can you just bring us the experience that you have had seeing it up close?
Well, from the data we have between 2018 and 2020, there was an Ebola outbreak in this region of the Congo with over 2,200 people dying. So the psychological trauma is still there. And with this current outbreak, UNICEF is deeply concerned because the outbreak is not only confirmed in the DRC, but we are having cross-border transmission in Uganda. And we think this is a serious regional public health threat that is unfolding in a highly fragile humanitarian context, which is marked by conflict, there is displacement, we have weak health systems, and major funding gaps. And as you rightly said, the strain is the Bundibugyo strain, for which we don't have approved vaccines or specific treatment. And this makes it very, very critical to have early detection, community engagement, infection prevention and control, and rapid response, which is absolutely critical to stop the spread.
I do want to ask you about infection control, because in past outbreaks of Ebola, we've seen some countries close their borders altogether to countries in which there is an outbreak occurring. There is some indication that may now happen once again. Is that a necessary step?
I think this can be necessary because we have to ensure that this is stopped immediately, and we have to reinforce surveillance to be able to detect cases on time, have contact tracing, and ensure that we have access to these very difficult humanitarian areas of Ituri in the Congo, in the DRC, where the cases are currently being diagnosed.
I wonder, just on a human level, I mean, we talk about the numbers of people who are being infected. We talk about the people who are dying. What does that look like up close?
Well, as I said, this is something we have to take very, very seriously. The strain, epidemiologically, the Bundibugyo strain is not very lethal. But from the data you've shown, we're having close to approximately 50% of people who are suspected infections of this Ebola virus dead. So it's very serious, and we have to really ensure that we put in all measures. Number one, UNICEF is working with the different organizations, Africa CDC and WHO, to ensure that we coordinate with governments to ensure cross-border prevention of transmission. Number two, we have to mobilize the communities. We need to reinforce and build capacity of the community health workers to go to the hard to reach. Number three, we have to prevent and protect the health workers by providing them with what we call IPC material, infection prevention control material, gloves, including protective gears for them to be able to treat the patients, and ensuring that there is community engagement and information sharing with these communities to know how to prevent infection of Ebola. And all this is happening in a situation where we have big funding crisis.
I think back to the last Ebola crisis, particularly in Sierra Leone and in Liberia, and the sheer number of healthcare professionals, of people who were trying to help, who themselves got sick, got infected, and died. You have instances now where there are healthcare workers who are sick with Ebola. What is the particular worry for those who are trying to treat the sick?
I'm very worried, but for two groups of people. The first one is what have you said, the healthcare workers. And these are people we need to ensure that they remain with the capacity to help those that are infected. And that's what I said. We have to provide them with the right infection
American
prevention control material. Number two group, we shouldn't forget the children. Children are always at risk when we have outbreaks because their immunity is still growing, and also because they are always exposed to be able to have these infections. And in addition to the direct impact of the outbreak, the loss of their parents and caregivers, that brings psychological disruption. There is disruption of basic social services. Healthcare is disrupted. Nutrition is disrupted. Even education is disrupted. And this can take away the results of the basic social services that we've gained over the years.
Dr. Paul Ngwakum of UNICEF, thank you very much for your time today.
Thank you very much for having me.